Hello, I'm Dr. Wendy Bridges and I'm going to talk today about GP mental health care plans. So the government has provided some funding so that people with a mental health diagnosis can get some financial assistance with seeing a psychologist or other allied health professional. So if you have mental health concerns, a good place to start is by going to talk to your GP. They're going to assess you and get the whole story, including doing standardised assessments or specific quizzes to find out if you have a mental health diagnosis, what it is, and are you going to be helped by seeing the psychologist. If you fall into this category, your GP can then do the paperwork to initiate a mental health care plan. This then unlocks 6 visits for you with the psychologist or other allied health professional, for which Medicare will provide a Medicare rebate. Now, the Medicare rebate will not be the whole cost of seeing a private psychologist. They often cost about $120 to $140, so there may be some out of pocket there. In every town there are bulk billing psychology services for people who cannot pay the out of pocket difference, so talk to your GP if this is going to be an issue for you. So Medicare has made a rule that the GP mental health care plan has to be 20 minutes. You must spend 20 minutes at least with your GP preparing this. The reason I'm bringing this up is it really doesn't work if you have had a 15-minute appointment with your GP and in the last couple of minutes you mention that you need a mental health care plan. They're not going to be able to do it for you in that period of time for a couple of reasons. First of all, unless it's a 20-minute mental health care plan about your mental health, your GP is not allowed to put that special item number to Medicare that unlocks the psychology visits. They just can't do that. You need a specific, at least 20-minute appointment with your GP to make your first mental health care plan. They're not going to be able to tack it onto the side of some other appointment. Also, that mental health assessment takes time. Your mental health is worth it. So if you know that you're going to be talking about getting a mental health care plan, please let the receptionist know and make at least a 20-minute appointment with your GP so that they'll be able to do that for you. If after 6 visits with your psychologist, your GP and your psychologist feel that you're benefiting from therapy and you would benefit from more therapy, you can return to your GP and do what's called a mental health care plan review. This then can unlock a further 4 visits with the psychologist for which you'll receive a Medicare rebate. So the normal amount that the Medicare will subsidise is 10 visits in a year. While we recognise that some people will need more visits with the psychologist than that, this is basically what Medicare will subsidise. If you have any mental health concerns, please see the links below. Please talk to your GP and help them sort out any questions you might have. I'm Dr. Wendy Bridges. If you need health information from a reliable source, I'm a GP. Subscribe to my channel.